So what does trauma look like, or what are some of the symptoms of someone who has experienced trauma? What does that look like when it shows up in your yoga class or in your therapy room? So it's really important that you be understanding of what might be happening physiologically and psychologically in someone's body, so that, not so you can classify them as having some issue, but so you can understand that that might be something that might be happening for them, and you can interact with them in a way that's sensitive and understanding of their situation. So the first issue that we see really commonly in a lot of the programs that we run is psychosomatic pain. So someone might explain to you that they've gone to see a doctor lots of times and they've had this pain, this mysterious pain in their body, and they're not sure what's causing it, and nothing that they've done helps. Sometimes that might be as a result of psychological symptoms that are manifesting in the body, because of course we know the mind and the body are connected. What someone with psychosomatic pain might also say after a few yoga classes is that that mysterious pain has suddenly eased or gone away. So that's a really common hint that maybe there's been some traumatic experience in the person. You might also notice a rigidity in their body. So it might be very difficult for them to move their body at all because of a lot of tense muscles and contraction. Or you might notice that when they do move into poses, that there's some shakiness in the body, and so that's also something to be aware of. The person might also be very easily overwhelmed by sensations in their body. So someone who's experienced trauma might often feel as if the body is a really unsafe place. So because of that, they're quite connected to their external world and things that are going on, but less connected to what's happening in their internal world. So when you're asking them to do a practice like yoga, where they're focusing internally on what's happening, that can be triggering for them. They can feel something in their body that they're not used to feeling before, or not used to holding space for. And suddenly that might cause them to feel panic or another uncomfortable emotion. So someone who might be disconnected from their body might have the opposite response, and maybe they are super flexible and doing lots of really intense poses, and it's as if maybe they're not quite connected at all and they're quite numb to what's happening. So this might manifest as someone looking a little bit spacey, or as if they're not actually present in their body, in the room, and that's because they're not. Their presence has gone somewhere else, and they're not inhabiting their body. And we'll talk about some techniques you can use to bring someone back into the room and into their body. People might share that, and this might be before or after class, people might share that they've had digestive issues, or that they've had difficulty sleeping. And of course we know that's something that yoga really helps with. They might also show during the class hypervigilance. So you might observe that the person, instead of connecting with their body, is looking around the room for a potential threat. And that's a real barrier for the person to actually just connect with their body and focus on the instructions, because they're so hyper aware of any potential threat that might be occurring. You might also notice that instead of this hypervigilance and this alert and anxious behavior, that you might see someone who's just really lethargic, and they might seem sluggish, like they don't have a lot of energy, and they might instead just find it really difficult to show up and to be present in class at all, and often that will be connected to depression rather than anxiety. Something that is also very common is a need to feel in control. So of course we know that in a lot of traumatic circumstances that control is taken away. So if you're in a yoga class and your teacher's giving you a lot of instructions, that can be triggering to somebody who does have a need to feel in control. So we embed a lot of empowering elements into our class to allow someone to have that sense of control. You might also notice in people that there's a hypersensitivity to light and also to sound. And that might manifest as somebody wearing sunglasses during class, wearing a hat and sunglasses, or being particularly sensitive to sound. Also, what might be happening is that there's an impaired proprioception. So someone, because they're not strongly connected to their body often, because the body can be seen as a scary place, the person, when they are connected into their body, it's like a really foreign place. And if you're to say you might want to reach your right arm up to the sky, it's as if the person kind of doesn't know where to reach their arm at all, or to step the feet apart and to turn right. These instructions might take the person a lot longer than they would most of the people in your class. And of course that improves with practice. And of course, thanks to the brain changing so easily, this changes really quickly. We also know that people might experience flashbacks, and so there might be something triggering that's said or done in class that might actually take a person back to re-experience their trauma. And we'll talk about different strategies you can use if that ever happens in class. There might be a mistrust of other people or an avoidance of closeness and touch. So we'll talk about strategies that you can utilize to build trust and to respect boundaries. We'll also talk about the opposite effect. So instead of being mistrustful, you might find that someone is very quick to attach to you and is very quick to give away a lot of their power. And that's another clue that possibly there's been some trauma history. There's also, of course, substance abuse, self-harm, eating disorders, all clues that there's been some history of trauma previously. But of course, all of this might be totally invisible, and someone might seem totally fine and put together, and you might have no clue what's going inside their head. So whilst it's important to be always looking to understand people and looking for clues, it's also really important to know you can never know what's happening inside someone. And the best you can do is just look for clues and as much as possible to help people to normalize any of these expressions that they are experiencing. And of course, to be aware that if the traumatic symptoms are severe, that actually yoga might not be appropriate for this person. So as great as yoga is, it's not fantastic in all situations. And so it is important that you're aware of the limitations of yoga in a group setting and that you're able to appropriately refer someone if the situation is just too triggering, and maybe they go away and work with someone one-on-one and then come back to a group situation at a later point.